articles, chapters, and books that he has authored or co-authored. Professor Mimica, we are ready to listen in your presentation with great interest. Please begin.
Thank you very much for this very kind introduction, and thank you for invitation to this conference. My pleasure is to present such topic on the title Therapeutic Knitting as a non-pharmacological part of management for people with dementia in Croatia. Let me give few words about this. I'm coming from the psychiatric hospital, and in this hospital we are treating people with dementia, and we are educating their families for many, many years, let's say about 143 years. We are having the oldest psychogeriatric department for more than 60 years, and it was first in the former Yugoslavia. So we know how the people with dementia look like, and we know that we need to give them more than it is support to give them today. So we are always trying to find new approaches. And now I will speak you something about another new approach which we are promoting last few years. My colleague Sandra Kerovec made this presentation, and I will show you what she put inside. The first slide is a memo of the most important, I would say, document which we have for last 10 years ago. And I was in this field before this document, so I can say that this is a very important thing. And also Thessaloniki was also involved in this, because the ADI conference was here, and I was there in 2010 before this document. And Mark Watson, who was the CEO of ADI at that time, he pushed this document, of course, together with the World Health Organization. And this is the most important document which we have. And now we are speaking about this with such effort and with such force. These documents change a lot of things in the research, but also in the clinical practice. You know, the field of the pharmaceuticals and drugs is moving very slowly forward. Only recently, we have 2 new drugs which are very promising, but it is only this year and last year. But before that, we had 18 years of no new drugs. So the other approaches, non-pharmacological approach, is very, very important. That means that in the hospital setting, of course, we are all our people with dementia had standard treatment. But it is not enough. We need to offer them also in the hospital settings, but also in the daily hospitals, nursing homes, and at their homes. We need to offer them more than medication which we have today. So let me introduce our therapeutic knitting. A non-pharmacological approach to people, but also to people with dementia, with mild cognitive impairment, early dementia, early stages of dementia, but also to their caregivers and to their families. We have a connection with colleague Betsan Korkil. She's an expert in this field. She knows much more than we do, but we are trying to find another possibilities, saying in our hospital also to introduce the therapeutic knitting to the persons with dementia and to their families. There are also another pieces of research which support this thesis, that there are a lot of benefits of knitting for persons and social well-being in adulthood. And there are some findings here from the international survey. You can see how persons are with lower stress levels, with better mood, with better cognitive abilities, improve social contacts, and so on. You can find much more benefits here, and there is a summary of the meditative, creative, and social benefits of knitting. But what we found it that is the best thing, or not the best, but very important thing, that this is a portable. You can take this with you. This is very important. We introduce this method in the hospital, let's say, patient like that. Some of the patients, I don't say not all patients, some of the patients like this, say, I like this. Yes, continue at home. No problem. We are giving them the wool, the needle, all they need if they want, and they're taking this. So, and vice versa, they can start at home and come with them to the hospital also. It is portable, it's very easy, it's affordable, it is not expensive. So, here you will see some photos and some videos. I hope, hopefully it will work. Can you put it on the slideshow? On the presentation. It is incorporated inside the slide. So you just put it runs. Okay. Just a moment. I'll go another one. Okay, this one goes. Okay. In this video, short video, you can see the knitting with patient in daily hospital, and this is in the hospital, our university hospital. Our nurse is showing how to knit to the patient, and you see another patient coming with the twiddle maps here, enjoying and very interested in all this activity.
Šal, rukavice, kapu, dekicu.
It is good for social interaction. It is good for the calming patients. It's good for the well-being. So, if you go to the literature, you can find, let's say, 25 ways of knitting can help persons with dementia. 2 slides here. I'm not going to read everything because we don't have enough time, but we have written the full paper, which will be in the proceedings of the conference. And after the conference, you can see the PDF on the website, whole paper about our experience with the therapeutic knitting. And here you can see this on the 2 slides. I'm going to show you now what we have done with our twiddle maps. And we have done European Twiddle Maps Awards in the Zagreb to make it more popular. And I'm going to give you these papers where you can see some winning twiddle maps. So let's look at this. And after that, I'm going to show you some of the examples of the twiddle maps also. But you can also watch this video. This is our daily hospital. And you see persons with dementia together with her husband in this video is knitting and enjoying this activity. And you see this big Christmas tree. This is also a product of our personnel and our patients. And some here, twiddle maps, you can explore them and see how they look them. These are some of the awarded twiddle maps from this content of the European twiddle map, and you can explore them. They have something inside. So it's a, you know. The one which are better, they have some story. Some of them have some story.
A summer story.
Summer story. You see the summer story, or you see some other, you know, landscapes or something. And it is very, very nice also for caregivers and also for the patient. And this is our big project, which was we doing the almost whole year, from the beginning of the year till the end of the year, till the Christmas. And it was big Christmas tree, which was done. Every person did a small part and then all together. And it was 5 meters high and 2 meters down wide. So thank you for your attention, and I hope you like this video maps.